Which of the following is the treatments is most appropriate for this patient? So 14-year-old patient, XY karyotype, pediatrician with concerns about the lack of male secondary sexual characteristics, ambiguous genitalia, small phallus, scrotal folds. Testosterone is within the normal range, but DHT is low. Which of the following is the most appropriate for this patient? Okay.
So first talk to me kind of diagnosis. You have to start with the diagnosis here.
Um, okay, it's either okay, I get the androgen insensitivity and what is it, the 5-alpha reductase deficiency?
Okay, good. You have the two diagnoses that could be it. I'm trying not to give you which one it is, but you're on the right path.
Um, and so we need to figure out, they have an XY karyotype. So I think we would like want to just, well, testosterone is normal, but DHT is low. So basically they have testosterone, but the body's not responding to it.
What's your gut say?
Okay. Can I get rid of estrogen therapy and testosterone supplementation?
Okay.
And then and also the GnRH agonist. I feel like you normally do that in females. I might just go with the androgen receptor, but I don't know if that's right.
All right. So actually this is 5-alpha reductase, right? The difference is for 5-alpha reductase is it converts testosterone to DHT. Okay. So if that's the case, right, then you want to replace the low DHT until he hits puberty. Because once you hit puberty, these patients that have 5-alpha reductase deficiency, when you hit puberty, you create so much testosterone that the body no longer kind of, in a sense, right, really needs DHT to develop, if that makes sense. So usually these patients before puberty have ambiguous external genitalia, but then after they hit puberty, right, they have penile enlarging and things like that because there's so much testosterone that them having low DHT doesn't really cause any issue, if that makes sense. But the androgen receptor agonist, right, you're probably thinking that it's androgen insensitivity. Androgen insensitivity, I want you to remember that they're genotypically XY, but they're
Uh-huh.
phenotypically female. And the way I usually remember and the way they usually test this is that um I mean this might not be politically correct, but the way I remember it is androgen insensitivity phenotype. These females, they have like they look like models, quote unquote, right? They're taller, right? Because they're XY, right? They have bigger breasts because all the testosterone, because they have extra testosterone, gets converted to estrogen, and then that creates bigger breasts, right? And they're hairless because they have no androgens, which androgens are needed to grow hair, like around the face, right, and kind of in the pubic area. So they're hairless. So all those traits, right, they're phenotypically female, but genetically they're XY. They're just androgens don't work. Also, those females too, or those phenotypically females, right? They can't reproduce. So that's kind of how you tell difference, if that makes sense.
So on our 14-year-old, so he, I guess, technically hasn't hit puberty yet if we're like looking to replace his DHT.
Mm-hmm. Mm-hmm.
And then after puberty, do we need to treat in any way?
Probably not. Usually not. If I remember correctly in the textbooks, they don't really go that into depth. This is obviously a little bit more in depth because it's asking about treatment. But usually after puberty, you should be fine because they have a lot of testosterone that will develop their secondary male sex characteristics.
And on the androgen and sensitivity, do we do the receptor agonist or is there a different treatment?
No, there's really no treatment because they're phenotypically female, right? So you don't want to take a phenotypically female, right, and then give her a bunch of testosterone to convert her into a male, right? You know what I'm trying to say? So I'm not sure what the androgen agonist is for. Yeah, I'm not sure kind of the androgen receptor agonist. I guess they're trying to trick you with the androgen insensitivity, but usually you don't give any medications for those phenotypical females.